We think about the children, that's merchants in the background there. And this morning we're talking COVID-19 and the children. This morning I want to welcome Senior Paediatric Emergency Specialist, Dr. Joanne Paul, to share with us some information about, children and COVID-19 and stuff like that. Good morning to you, Dr. Paul.
Hi, good morning. Lovely to be here. Thanks for having me again. So do you want me to go straight into it? I can just
let me jump in one time. Jump in one time.
No problem. So, since we started the pandemic, I think the first thing we saw was that the adults were more infected, etc. But it's migrated now. We had Delta, which we knew had gone on to having more exposure with children. But with the Omicron variant, that's a little bit of a game changer again. And so what we're seeing is that it's still mild in children. Right? That's a definite fact. But because it's so much more infectious, you're having a lot more children now being affected by it. And so we also, in comparison to when we had lockdown, so we had children at home and we had them a bit secluded. So we had a surge, but we had lots of mild and asymptomatic. But now we're definitely seeing an upsurge in cases. So right now, I called my guys last night in pediatric emergency, and they were busy. They have been busy for the past few weeks or so. So we've seen a definite upsurge with regards to this new variant coming through. And so the main things we've been seeing, and also worldwide, because although we think we're a small country in Trinidad, we are, but we still, in terms of medicine, we try to be holistic as possible. So we check out most of the other countries, get our information, all our colleagues are there. We see the trends from there, and we look at our trends here. And we're definitely seeing fever, for sure. We're seeing a height of fever. Most children right now will present with fever. The other thing is the age group. You will have it like in less than 2 years old. Now, less than 5 generally affected, but we find with less than 2-year-old especially, because the immune system is not as strong. Mm-hmm. And then we have the adolescent period will also be affected.
Well, good morning to you, Dr. Paul. Natalie here. I don't know where we stand, because I remember that at one point we were being told that when the population was very concerned about children presenting with Miss C, we were told at the press conferences that, there won't be any long-lasting effects, and yes, you'll expect that children might catch COVID, but not only that, that their immune systems are good, and that they have been exposed to COVID-19s at their younger age, not COVID-19, but to coronaviruses, and that therefore they will be okay, they'll be fine. What has changed?
Right, that's the thing. So I agree with you totally. Before this, we had the other variants, and they definitely had mild infection, asymptomatic. We had MIS-C and long COVID, still with children, and that was not the focus. The change is how infectious Omicron is. So therefore, instead of having, some persons have shown that the R0 factor is about up to 10, so it's 8 to 10. So it's shown that the Delta was more infectious than the original ones and the Alpha and the Beta, but now the Omicron is now even more infectious than Delta, even like about 4 to 5 times more, some say even 10 times more. So with that difference, not so much that, so children generally are becoming infected, but because we have much more infected than we see in that whole range of presentations now. And we used to have it where we still had it where the younger ones will be the ones. So for Delta, I would come on, lots of persons will come on the news conference and say less than 3 months old, that infant age group was still affected. Now, because it's so infectious, we're having a lot more of them infected. But it's still the differences are the fever. The difference with this one, though, is a croup. We're having lots of upper airway issues. So they'll be congested. They'll be having this dry, congested cough. They'll be croupy, and they'll be sounding a bit like that, a bit like, so like almost like a dog barking or a seal barking, and the sore throat. That's the difference with the Omicron. It's they have really, aside from just upper airway issues. So if you're having your child having a sore throat and having that upper airway congestion, you know it's a new variant. And what they found with the height of fever with this one is that you're gonna have fever fits. So usually with children, it's not so much that the fever is so blasting high, when it spikes up and when it gets really a fast spike where it goes like from here to really high in a short few seconds, that's when they have fever fits. So the main thing I'm trying to tell parents is, first of all, do not panic. Most of the time it's going to be mild for sure or asymptomatic. But in some cases, you will have your child, especially the ones who are less than 2 or the adolescent ones, showing up with symptoms. And that's when you're going to be prepared. You're going to monitor. And if you need to, bring your child to the hospital to be taken care of. And the things to do in terms of being prepared, easy stuff, because you have the knowledge there. You know it can happen. You know you're going to watch your child and say, okay, I'm going to watch you. You have symptoms suggesting. I've done my PCR test or my antigen test. It confirms it. The entire family has the infection. I know that my child also has it too because it's highly infectious. I'm going to monitor. Thermometer. I'm checking my temperature. I'm being my nurse at home, checking my temperature every 4 hours. I have my oxygen level, checking on that. I'm expecting sore throat and upper airway issue and congestion. So I'll have my paracetamol or my Panadol, my ibuprofen, my saline nose drops. And you can even make your saline nose drops if you want to, or buy if you're not sure. Humidifier, vaporizer. I have my inhaler with spacer if I know my child has been asthmatic. Also, I will check in, like I'll check YouTube or check with a care provider in terms of what to do if my child is having a seizure. Definitely if my child is having a fever fit, I'll be watching through that. Also, I'm gonna look out for, if I have my child has sore throat, I'll be looking for things to make sure they don't get dehydrated. So you'll make sure you have your watered down Gatorade, your coconut water, your fluids. And if the child is younger, lots of milk. If my child is less than 6 months old, I'll be breastfeeding as much as possible to give that child lots of antibodies. So I'm doing my prepare, I'm doing my monitor, and if I'm worried, check in with a healthcare provider. And if I'm still worried or something is happening, I go to a health facility to be seen. And when I get seen, I do not just, and I really am an advocate for this. I really don't, we don't do it as much in Trinidad, but lots of countries do it where we go to the hospital or we go to the health center or to your pediatrician. And it's where we just say, well, the responsibility is now in their hands. It's your hands and their hands. It's a joint responsibility. So when you go there, if you find that you have questions, it's your right to know everything about what's happening with your child, get a clear diagnosis, makes it your right to also be in agreement with the management plan. So you have all the information, they've explained everything, you agree, your senior child getting better. So the joint responsibility, it's you and your healthcare provider. So prepare, monitor, contact your healthcare provider, and go to seek help if you need to.
Now, Dr. Paul, this is very, very useful information. Thank you very much for it. I really appreciate that. It seems as though the ways to fight this for your child, or to monitor, the first part of the monitoring process seems very similar to if they have the normal flu, the normal cold, minus the oxygen, of course, and the temperature checks every 4 hours, but even sometimes they still do that. But I'm very curious about the breastfeeding for the 6 months and under. If the family has COVID, i.e. the parents also have it, the mother would be COVID positive as well, is that breast milk going to contain antibodies, or is it going to contain the virus, or have we been able to assess that as yet?
Yeah, so I'm hoping that family, that mother would have been vaccinated. And so if they've had that, then she'll be having nice antibodies to impart in terms of the breast milk to your child. Because remember, we don't have the option of vaccination up from less than 11 years old. So in terms of that added protection, but the immune system with that less than 2 years old, that less than 1 year old, is still very weak. So they're very much at risk of. So if, for instance, 1, she's had a vaccination, or 2, while she herself is recovering from COVID, she'll be making antibodies. So just by having the infection cell will provide some antibodies. And so whatever it is, give that extra protection. And going back to Natalie's comment about the previous coronaviruses, they've shown that the 5 to 11 age group, that is very bimodal. That age group, because they've had some previous infections from corona, not COVID, but from coronaviruses, they have shown some additional protection. So that's why I'm focusing so much on that age group of less than 2, less than 5, because they have not had their exposure to corona. They have their immune system lower, and therefore they're more at risk. And of course, it's a young child. If you're having, if a young child, say a 9 month old has a sore throat, I mean, they're not going to tell you they have a sore throat. All they're going to be doing is having high fever, being lethargic, being drowsy, in pain, just groaning, and therefore, and they mightn't take the breast milk or the feed, and so they might just be sore throated and feeling unwell and having a high fever, but they can't cope. So therefore, once you're seeing those things happening and you're trying all you can, you definitely have a lower threshold for taking them somewhere and making sure you protect and take care of your young child. The
Doc-
other bimodal distribution is also the adolescent ones. Again, although we've had vaccines available for them, they're the ones who have had the comorbidities. And a key point there, and I mean, I know I keep talking about it often, obesity is a major factor. So we have that age group. I know in Trinidad, we don't have as healthy a population as we could have. So they're the ones who have their diabetes, other comorbidities, and obesity. And in addition to that, aside from the fact of the obesity, when we have the comorbidities, a key thing we realized, not that we didn't see it before, but the COVID-19 virus itself, not only does having your comorbidity make me at risk of having a more severe COVID-19 infection, but the actual COVID-19 virus, it makes me even more diabetic. So what I found is that it does cause all your organs to be inflamed, and even your pancreas, which is the organ that makes insulin, that will also be inflamed such that it would not produce as much insulin, and all your different factors in your system will be in a pro or diabetic or pro glucose or pro inflammatory system. So therefore, not only is my comorbidity making me more at risk because my immune system is lower, my COVID is exacerbating that same said comorbidity. So it makes me more diabetic. It makes it, if I'm predisposed because of my hypertension to having strokes and heart attacks and clots in the lung, it also does that. And so with the hypertension or with the high blood pressure, it exacerbates the effects of it. And therefore, I'm even more prone to having, especially if I have a family history of that, more prone to having strokes and heart attacks and clots in the lungs and having kidney failure, etc. So that's why the comorbidity thing has been a big issue. It exacerbates it and it unmasks it. So even if I've seen lots of persons who before this they were like, hey, no, I'm pretty healthy, and then suddenly with COVID, they've shown that they're now diabetic, and they'll be like, well, what's happening, JP? It's because the actual virus unmasks that predisposition. So if you were before, if you had a family history of, it exacerbates it. It's like, when you're older, of which I'm not yet, and and when you when you'll be going get some virus, and like when they had chikungunya, remember they used to find that afterwards all those old niggling injuries that you forgot about, some old back pain from somewhere,
yeah.
and some old knee injury, with that it unmasks it. So with this COVID-19 virus, it unmasks all those predispositions. So even if you think you're healthy, you may be pre-diabetic, pre-hypertensive, pre at risk of having all those things, and then the COVID virus exacerbates that and unmasks it. So no matter if you think you're healthy, I would say make an effort to keep yourself balanced, physical health balance, trying to exercise, eat healthier. Because when you do get infected, although Omicron is milder, if you have a family history or if you're going to be exacerbating your comorbidity, you want to have the best chance possible.
Dr. Paul, we've been talking about side effects and adverse effects of the vaccines. What can you tell us about children who have taken the vaccines? Have we seen any side effects or adverse effects, to the vaccines thus far for those who've been vaccinated?
Right. So most of the effects, surprisingly, so we've had a normal, local irritation, etc. Most of the effects when they started becoming vaccinated in terms of that age group of 12 to 19 were really anxiety related because they were so hyped up, right? They were at home. So there was the mental health issues of being home and anxious about online school. I'm anxious about the unpredictability of this pandemic. But and of course, the parents were also anxious about having their child vaccinated just because they thought it was new, etc. So what happened is that when we had the vaccination started, you had a lot of children, adolescents being anxious. So they'll have almost like a anxiety attack with it. They had chest pain with it. But what we've shown so far, because at that point in time, all of the any adverse events per se or side effects were coming to the pediatric emergency department. They were calling a few of the team members and making sure we review the cases, and they were really all mild with anxiety related because they were so anxious about the vaccine. We had a few. I mean, we know about it in terms of Pfizer vaccine in the adolescent population, where they had, well, we know that in terms of internationally, there's a risk of having myocarditis or just the lining around the heart itself being slightly inflamed. So we were aware of that. And a few of them who had chest pain, we really monitored, we had them monitored for these 24 hours. But we found afterwards there's nothing there. I myself had no case in terms of the adolescent population who had their vaccination, who had any severe adverse events. It was always mild and also very anxiety related. So I'm quite comfortable when parents ask me, should I have my child vaccinated? It's all about risk. So you wait. So therefore, nothing. It has no side effects whatsoever. If I take too much Panadol, has effects on my liver. If I take too much Advil or ibuprofen, it affects my kidney. If I take too much bush medicine or herbal medication, it has side effects also. So it's all a matter of trying to weigh your risk. And the thing about it is that if I have my child vaccinated, I mean, and I think Dr. Professor Montai said it very beautifully. She's like, in Trinidad, we're so lucky because we've had not just the pool of persons here who have been vaccinated, the entire world, UK, USA, they've been having vaccination. So we've seen that pool. It's almost like an extra trial for us. So we've seen really, it's very, very rare. It's uncommon. And once you know what the risks are, you look for it. So if you wait, you have the risk of having a vaccine adverse reaction, which I have seen no severe ones in children so far since the vaccination rollout started, in comparison to your child being COVID-19 infected and having to end up in hospital where we've had deaths for children. So
do we have the percentage of children who've ended up hospitalized? Because we keep being told that most children will be asymptomatic or mild. Do we have any kind of stats as to the kind of numbers of children who will end up hospitalized?
Yeah, so previously it was less than 1%. So it varies internationally, goes from 1 to 2%. In the beginning, ours was less than 1%, and it's migrated a little bit higher. Now we're having more cases in terms of probably between 1 and 2% now. So you're still, and of course, when you look at the ages, very, very particular, the ones in hospital, again, it's clear age groups. They're going to be between 0 and 5 years old, and then they're between the adolescent, 12 to 16, and usually 14, 15, lots of comorbidities, cerebral palsy, cardiac issues, and obesity as the main factors. Yeah.
All right, Dr. Paul, we do have to leave it there, but thank you so much for sharing with us this morning. And hopefully the parents who are out there listening would have gotten valid information that can help them to move forward.
It's always a pleasure, Natalie.
All right, Dr. Joanne Paul, they're a Senior Pediatric Emergency Specialist, talking to us about children and COVID And if you have the child, please, she says, make sure you monitor. Make sure you monitor and pay attention to what's happening and to know when you need to take further action. But we're going to go to a break and we'll come back with much more. Stay with us.
Not later, right now.